Thank you, Mr. Speaker. Can the Minister explain if these new restrictions for areas like Bolton are only advisory, will hospitality companies affected still be eligible for financial support? And why the Public Health England report on variants was snuck out at 11 p.m. on Saturday during the Eurovision final and minus the promised data on school outbreaks. The B1617.2 or April 02 variant appears to be 50% more infectious and is affecting even younger children. So can the Minister explain why on earth the government ended the wearing of face coverings in schools? While it is good that 2 doses of the vaccines still provide good protection from this variant, testing shows 1 dose is only 33% effective. The gap between doses has been shortened from 12 to 8 weeks, but with less than half of those between 50 and 65 years of age having had their second dose, are there plans to close the gap further?
I'm grateful to the Honourable Lady's question, and I would just remind her that Public Health England make those decisions for themselves and not up to the Minister when they actually release their data. On pubs and hospitality, indoor areas of venues, whether it's cafes, restaurants, bars and so on, can reopen, and any premises serving alcohol, customers will still be, of course, required to order and be served and eat and drink while seated. Venues are obviously prohibited from providing smoking equipment such as shisha pipes and so on, really just to make sure that we do everything we can to limit the ability for the virus to infect others, and to, within that, reducing that social contact is incredibly important. Some businesses, of course, such as nightclubs, must remain closed and follow restrictions. And so it really is very much about making sure that we work together to control this B1617.2 variant, exercising that common sense that the Prime Minister spoke about, and the guidance is there to do that. And people on the whole have been following that guidance. Of course, on transmission and the effectiveness of the 2 doses, and her question around accelerating the vaccination programmes, the whole idea of us following the JCVI guidelines and advice on vaccination is we've been able to vaccinate at scale. We've got 2 big weeks coming ahead of us, and we'll continue to focus on the second dose. So when people get that text message or the call to bring forward their second dose, please take that up. It's incredibly important in controlling this variant.